Okay, let's just dive right in. We've all seen the headlines, right? The skyrocketing cost of healthcare in the United States. But today, we want to go behind the curtain. Look at the corporate ledger. We're going to peel back the numbers that insurance providers are actually showing to American businesses. Our mission for this deep dive is really specific to figure out exactly what corporations, and this is the key part, what their employees are actually paying for group health insurance. And we're using the most current data we have, so figures from 2023 and early 2024.
And this is so much more than just a theoretical exercise. Understanding these costs, it's critical for financial planning for companies, for individuals.
Yeah.
When we talk about corporate costs, we're not just talking about a line item on a spreadsheet. I mean, this is a fundamental, massive, and highly variable part of employee compensation. It's a huge liability on the balance sheet for pretty much every major employer in the country. And if you're an employee, this knowledge helps you see the true, full value of your benefits package.
Absolutely. And the big hook here, the thing that this whole discussion is built on, is that most American employers pay the bulk of the premiums. But just saying they pay the bulk isn't really enough. The question is, what is the true sticker price to keep an employee covered? And how is that cost actually split up mathematically? We're diving into the dollars and cents.
Yeah, and the complexity of the U.S. health system. It's overwhelming. I think a lot of people just get this sense of dread, or they just kind of shrug when they look at their benefit statement. Our goal today is to replace that dread with some precision. By the end of this, you should be able to look at your own pay stub, your own benefit statement, and know exactly how your piece fits into that much bigger corporate puzzle. You'll get the cost drivers.
That is the plan. So we're going to structure this really clearly. First, we'll lay out the hard baseline numbers, the average annual costs that the employer is swallowing based on 2023 data. Second, we'll analyze the contribution model, that standard 70 to 80% split. We'll use a real-world example to show what the employee's share really looks like. And finally, we'll get into the critical variables, the four key things that cause these costs to just fluctuate wildly from one company to another.
Yeah, and understanding these costs is just so crucial. The numbers we're about to get into are significant, and I think for a lot of people, the sheer scale of the total premium, even the part the employer pays, it's often pretty surprising when you see the actual annual dollar amount.
Okay, so let's start right at the top. The headline numbers. What is the baseline financial burden an employer takes on before an employee even sees a single deduction from their paycheck? And we have to make a distinction right away, right, between single coverage and family coverage. Because that jump in cost it's monumental. It defines the whole conversation.
That distinction is everything. It's paramount. It immediately tells you the scale of the risk the insurance provider is underwriting. And for any employee, it's that first big decision point. Do I enroll just myself or my whole family?
Right. So for an average individual health plan, what we all call single coverage, the data shows employers are paying about $7,000 to $9,000 per employee per year.
Per year.
Just to keep one person on a standard group plan, I mean, that's a huge non-wage benefit cost, just baked right into the cost of having an employee.
And that range, $7,000 to $9,000, it might seem tight, but it already tells a deep story. Think about it, a $2,000 difference per employee annually. If you multiply that by a workforce of, say, 10,000 people,
Wow.
that's $20 million very, very quickly. So we're already seeing the seeds of those key factors that create all this variance.
Okay, tell me more about that. What makes up that $2,000 difference, even for just one person?
Well, it really boils down to two main things we'll dig into later. The risk the company is willing to take and how rich the plan is. An employer paying on that low end, the $7,000, is probably using a lower cost plan, maybe a high deductible plan. Or they're just a massive organization with incredible bargaining power, so their risk pool is super predictable.
Okay.
The employer paying $9,000, they're offering a richer plan, a PPO with lower deductibles maybe, or they're a smaller company and they're just facing less favorable terms. That $2,000 difference is the first sign of the company's benefit strategy.
That's a huge variance on just a single plan. But hold on to that number, that 7,000 to 9,000. Because the jump we see when we move to family coverage is where this becomes a massive corporate headache.
It really is. That's the moment the financial exposure just explodes to the company. You're not insuring one person anymore. You're insuring a whole complex family unit.
So the sources show that for employees who add family members, a spouse, kids, or both, The employer's contribution jumps from that $7,000 to $9,000 range
Wow.
all the way up to a staggering $17,000 to $26,000 each year.
Wow.
I mean, we've more than doubled the minimum cost, and the top end is almost 4 times the minimum for an individual. That's a steep curve.
What's really fascinating here is thinking about the leap in risk versus the leap in cost. When an insurance company covers a single person, they're calculating risk based on one individual. It's relatively contained. But when that person enrolls their family, they're adding 3, 4, maybe more individuals into that pool. And the cost doesn't just multiply by the number of people. It multiplies by the variability of their health needs.
And the demographic profile of those family members is so much more diverse. You could have young kids with a lot of pediatrician visits, or maybe a spouse with a chronic condition that requires expensive drugs.
Exactly. And that high end of the family range, that $26,000 contribution, that's directly connected to the sheer scope of risk being pooled. If a family has multiple people needing specialized care, the chance of a really high-cost event just shoots up exponentially. So the system needs those high total costs to buffer against those few, incredibly expensive claims across the whole group. That $26,000 isn't just for checkups. It's the premium you need to insure against that low-probability, multi-million-dollar catastrophic event.
That $26,000 figure for the employer's share alone is just, it's a jaw-dropper. In some budget discussions, that cost for one employee's family could exceed the total salaries of several lower-wage employees for a whole year.
That's the essential context. It puts the whole idea of a benefits package into sharp focus. When a company is paying up to $26,000 just for their share of one family's plan, that's like a huge fraction of a mid-range salary. In some cities, that's the annual rent for a decent chunk of office space. It just highlights why group health insurance is the single biggest financial lever in vulnerability for U.S. employers, outside of salaries.
Right, and that gives us the scale. But remember, these numbers, $7,000 to $9,000 for single, $17,000 to $26,000 for family, that's just what the employer pays. It's not the total sticker price. So to really get the whole picture, we have to look at the contribution model itself, how the total cost is split. We need that missing piece of the puzzle.
And this is where we analyze the established norms for cost sharing. What's surprising is that despite that huge variability in the dollar amounts we just talked about, the proportional split is remarkably stable across the country.
So if the dollars are all over the map, what's the general rule for the percentage split? What's the, the competitive baseline?
The core finding is that employers typically cover about 70% to 80% of the total premium. That's really the established majority rule. If a company drops much below that 70% mark, they start to look really uncompetitive in the job market. So it means the company's paying the vast majority of the cost, which makes the employee's fraction, relatively manageable, though it's still a lot of money in absolute dollars.
That 70 to 80% range is so crucial. It's not just a ratio, it's a standard of competitiveness. A company using that split is basically signaling to job candidates that they're serious about covering healthcare costs.
Exactly. Now, there is a key nuance here, especially when you look at the type of coverage. The sources point out that most employers pay that 70 to 80% for employee-only plans. That makes sense, right? They want to incentivize people to sign up. But they almost always pay a slightly lower percentage for family plans.
That sounds like a tiny detail, but if we connect it back to the huge total premium we just talked about, a small percentage change on a $25,000 plan is a massive dollar shift. Is that basically a strategic cost control policy?
It is geometrically significant, and yes, it's absolutely a strategic decision. Let's just run the numbers. Say the total family premium is $25,000. If the company covers 80%, the employee pays $5,000.
Okay.
But if the company drops its share to 70%, the employee now pays $7,500. That 10-point drop in coverage just shifted $2,500 of cost directly onto the employee for the year.
So the employer is still paying a massive amount in dollars, but by just tweaking that percentage down for dependents, the company is subtly pushing employees to shoulder more of that family risk.
That's precisely it. Companies really incentivize individual coverage because they need that employee for the business. When you start adding dependents, they expect the employee to carry a greater proportional burden, even though the employer's dollar contribution is still way higher than for a single plan. This cost shift is such a critical point for anyone out there budgeting their payroll deductions.
Okay, here's where it gets really interesting. Let's take those abstract percentages and make them concrete. Let's look at the specific 2023 data example from our sources for a typical family plan. This is going to pull all the numbers we've discussed together.
Let's do it. So let's lay out the full sticker price. the amount the insurance company charges before anyone shares anything.
The sources show that the total annual premium for that typical family coverage is approximately $25,000 to $26,000. That is the actual price tag the company is responsible for paying to keep that plan active.
And just to reiterate, that's the base cost to insure one employee and their family for 1 year. It's a staggering figure. It really shows the high underlying cost of medical care, the administrative overhead, all the complexity in the U.S. system. It sets the stage for the financial battle.
So now let's apply the contribution model to that $25,000 or $26,000 total. The sources say the employer pays around $17,000 to $19,000 of that total, which that lines up perfectly with the 70 to 80% rule we talked about. It's right around 75%.
And that dollar amount, $17,000 to $19,000, that's the explicit corporate investment in that one employee's health and security for the year. It's an incredibly high number that is often just invisible to the employee, but it's deeply baked into the company's operating costs.
Which, simple math leaves the employee to pay the rest, $6,000 to $7,000 a year. And that's the part that hits your bank account directly through those payroll deductions we all see on our pay stubs.
And if we connect this to the bigger picture, that mandatory deduction of $6,000 to $7,000 for a family plan is a fundamental part of the compensation trade-off. Even with the employer covering 3/4 of the cost, the employee's share is substantial. It's roughly $500 to almost $600 a month, just for the premium.
Wow.
And that's before you've even hit your deductible or paid a single copay.
It's a perfect illustration of what you could call premium compression. The company covers most of the expense, but because the total cost is so astronomically high, the employee's small fraction is still a huge financial commitment. You're basically paying that monthly fee just for the right to use the plan.
It's the cost of entry. And this proves, quantitatively, that while the corporate cost is immense, the burden is truly shared. So now that we've got the averages and the split, the next logical question is, why? Why do some companies pay on the low end, say $17,000, while others are on the high end, closer to that $26,000 max? That gets us to the variance engine.
Exactly. So now we're moving into the really dynamic part of this deep dive, the variability. Why is the insurance premium for the exact same job at company A maybe thousands of dollars less than at company B? The final price isn't arbitrary. It's a calculation based on 4 foundational pillars of risk, leverage, and access.
These are the levers that the actuaries and the underwriters pull when they're figuring out the final quote for a corporate group plan. If you understand these 4 dynamics, you understand why health insurance is just inherently unequal across different employers.
Okay, let's start with the one that feels the most intuitive, company size. What's the core principle, and how does being bigger actually translate into lower premiums?
So the core principle is statistical leverage. Larger companies almost always pay less per employee.